Thank you. So I think the biggest thing for this discussion is that there are not going to be a lot of graphs and things like that. There's not a lot of medical information. It's just more practical information for patients. And so, this is the whole idea here is what is a center of excellence and why does it matter? How does it help? What does it do? And so one of the reasons that there's a role for this is that Wilson disease, as we've heard earlier, it's a really hard diagnosis to get correct. One, it's uncommon, so sometimes it's not even being thought of. It can range, as previously discussed, from completely asymptomatic. We find it on accident because someone's blood tests were elevated and they came to a liver clinic and we looked for it and found it, to immediately life-threatening. We've taken care of patients who are in the ICU in need of a transplant to live. And so that range of severity makes it challenging as well. I think the other thing that's really unique about this disease, and other rare diseases are similar sometimes, in that they can mimic other problems because the reality is there is a lot of overlap. Symptoms in one organ system or one area gets you maybe to a neurologist or to a hepatologist, and so that makes it difficult. And then additionally, even once you think of it, and even once you start testing, the testing is not straightforward. As a hepatologist, I take a perfect example of sort of a straightforward diagnosis. If you have hepatitis C, we do a blood test. It's positive or it's negative. It's pretty simple to tell you whether you do or don't have it. This is much more difficult. There are multiple things that go into diagnosing the disease. And essentially, I think of it like weights. What are you putting on the weights towards or away from the diagnosis? And things like the Leipzig criteria and other things are just us, almost like an attorney, building a case against or for the disease. And again, as opposed to here, your hepatitis C antibody's positive and your viral load's positive, we need to treat you. It's not straightforward. So, because it's complex, and this word or terminology is often used when we're talking about healthcare delivery, fragmented. And this is not a knock on community doctors. This is not a knock on your local physicians. This is just a reality of how the real world works. If you are, say, the patient, and you went to see your primary care doctor and you had elevated liver tests, that might be the first person that notices anything even slightly abnormal. Or maybe your primary care doctor notices you've got a tremor and they send you to a neurologist. Or you have anxiety, depression, or some other psychiatric condition that gets you sent to a psychiatrist's office or a counselor, or all these options. The point is, out in there in the world, wherever you may live, you may see the neurologist who works in a different office or completely different practice from the liver or the GI doctor who works completely separately of the psychiatrist. And that fragmentation, the idea that they all are working on, they're all focused on the patient, but in different scenarios and in different places, and that communication, it happens. I'm not sitting here saying people don't communicate, but it's difficult. It's not a straightforward thing. And so, a Center of Excellence care team really talks about, there's a couple things. You're both diagnosing and managing. And so keep in mind, when you're talking about liver disease, we have the hepatologists, people like us who take care of patients with liver disease. The transplant surgeons are the physicians who actually cut livers out and put new ones in. And then in the neurology, we have neurologists who basically, like Dr. Tate. Then even within that, especially in a clinic that does movement disorders, you're going to have physical therapists, occupational therapists, recreational therapists, speech pathologists. And then on top of that, then you have behavioral health, psychiatrists, psychologists, neuropsychiatrists, which is neuropsychology, which is a whole other field. And so the idea is all of these things overlap for sure. And then on top of that, there's even more. On the clinical side of things, I mentioned things like the ophthalmologist, geneticist. This is a genetic disease. What are these, when you're in a family with a mutation, what does that mean? That's what genetic counselors help us figure out. Dietitian, nutrition, we're gonna have a talk in a couple minutes about how diet and, the copper diet or low copper diet and how things, affect that. You have a clinical pharmacist like Alyssa who went over things like how to get your medications, social workers that help navigate some of these sort of other issues, and then a nurse navigator, the person who's your point person, the person who, when you're calling the office or calling the center, that's the person you're often talking to. And then on the research side, you have your primary investigator, you have the physician who's helped running a study, and then you have research coordinators who are usually the ones physically part of the time seeing you during your visits or reaching out to you. And so the idea at a Center of Excellence and how this is maybe different from the community is that in the middle of all this is the patient. This is the scenario in which we're trying to make sure that all of these moving pieces are at least centered on one spot and that the focus and the coordination of care happens that way. So physically, what is an actual COE, Center of Excellence? It's a designation conferred by the WDA, these people, that with the advice of their medical advisory committee, which is comprised of physicians here, and set criteria. And so one of the things, and as I'm listing these off, I'm quite literally listing some of the things that show up on the website that we as a center, when we apply, quite like put down bulleted answers to how we're going to address this. Enthusiasm of the center's providers to comprehensively manage all aspects. Multidisciplinary clinical expertise. I think that is the most important piece of this. It's all of the specialties, or the majority of the specialties needed all together. Commitment to education, and we'll come back to that in a little bit. And then dedicated research. So, not to leave out our colleagues in London, I'm just talking about the U.S. Centers of Excellence for the moment. And these are the ones across the U.S. from West Coast to East Coast. We have them everywhere. And then as of today, as we just learned, also University of Miami. So, depending where in the country you are, you may have one closer or further from you, but the point is, there hopefully is something in your geographic region that you can find the people you need. And right below that is the actual website where you can find the listing of those places. So organizing a visit, I think the one thing that thankfully Dr. Shilsky sort of pointed out to me is you can enter at any point, right? If you saw a neurologist because of a tremor, and Dr. Tate, for instance, thought of this and did the testing. Well, now you might end up over with us in liver disease to do more testing, et cetera. And the idea, though, is that no matter how you got in, whether it was a neurologist who referred you or found you, or someone in the behavioral health sector, or someone in liver disease, the idea is once you're there, we're trying to determine what needs the patient has. So for instance, some people may have a predominantly liver presentation with minimal effects on the neurologic side of things, and they don't need to see a neurologist. They just need that aspect there in case that's needed. And the idea there is that because it's difficult to diagnose, sometimes our job as a center of excellence is to try and just work through the diagnosis. Be sure, or as sure as we can be, that the patient does or doesn't have it. The other thing is sometimes, especially because these treatments are not common, and B, difficult to get, the expertise in actually starting monitoring, but also just getting treatment is part of it. And then I think a big piece of it with all these overlapping things is the idea that there's care coordination involved. Again, not to say that that's not happening in the community, but it's a little more centered in a center of excellence, no pun intended. So, education, the things we always think about is, most of the places that are going to be affiliated with the Center of Excellence are going to be at academic medical centers. And that means there's usually a medical school, residency programs that train people to be physicians, fellowships that are the subspecialties beyond residencies. And, the idea there is that you're affecting by teaching everybody from other attending physicians and people out in practice all the way down to medical students, raising awareness from an early point in their careers, acting as an educational and consultative resource. Again, it's a rare disease. A lot of doctors, even if they think of it and even if they test and find it, they still need a lot of people because they don't see maybe more than one or two of these, or one or none in their career. And some of them doesn't live by a center of excellence, they're going to need help and guidance, and that's partly what we also do. And then the patient, family, public, and continuing medical education. The point there is we're trying to raise awareness, we're trying to aid teaching for this disease across patients, physicians, and everything in between. Then the expertise and education part of this. There's a quote in the WDA guidelines for trying to apply for this. Physicians are well trained in the diagnosis and treatment of patients with Wilson disease. Well, that's a very great statement. In the real world, though, if someone like me had only seen one in my career, how can you say that? And the answer is, because it's rare, we have to have the experts in the field really acting as mentors to newer physicians. I'm trying to not use old and young. I'm trying to use experts and newer. But, as we often say, sometimes I need to ask someone who's got a little more gray hair than me. And so it's not, this is the way the next generations sort of get to understand and learn about this disease. And I know Rhonda and others have touched on it, that to spend, aside from going to Europe, which is fun, to spend 3 days all day learning about one disease from people who are researching it from all aspects. It gives you a sense of how much, even though this is rare, how much knowledge is out there and how much knowledge is being sought. And I think the biggest thing is, and I don't want to speak for people who are more not as new as me or older physicians, but the reality is them sharing that knowledge to the next generation is what keeps things moving. You know, you can't expect someone to come right out of medical school and just know everything there is to know about Wilson disease. It takes the people in the world working on this, and even the people who are more senior are learning from each other. That's what conferences like this do. And again, research, other people have touched on it, so I don't want to belabor it other than to say, you know, the research side of this, why does that matter? That you've already heard. I think the most important thing is that what a Center of Excellence may do compared to, say, in the community, is that these clinical trials obviously are going to be run through academic medical centers that have the infrastructure, both to do what we call basic science, which is when you think about, you know, test tubes and microscopes, you know, the basic science is the looking at the underlying mechanisms of the disease and the treatments. And then there's the clinical trials. It's the physically getting what they figured out in the lab to the patient. And that's when we start talking about different roles of clinical trials. So, you know, to summarize it really, there's advantages. You know, there's multiple specialists in one location, and we're regularly communicating. There's shared expertise in a rare disease. There's access to clinical trials, and in some levels, because we're always talking and because we're interacting and going to these meetings, we're sort of staying up to date on the newest advances in the field. Disadvantages, obviously, when we're talking about, you know, 9 or 10 of them total in the country, it's a distance to travel oftentimes, and there's an inconvenience associated with that. Now, I was, you know, suggested I would remind people that there are resources through the WDA to patient assistance, basically, to help a program, to help travel to a COE for at least one-time evaluation, sort of to get the things sort of on track, if you will. So in summary, this is a rare disease. It's difficult to diagnose. Care can be fragmented, which makes that diagnosis even more difficult. A Center of Excellence really brings together multiple specialties in one location. It's really geared at diagnosing and managing. The COE really facilitates your evaluation and management across several specialties. And then at a COE, you're going to be on the forefront of medical expertise, education, and research. And then the good news is we'll also have all the things from today on the WDA YouTube channel after the conference in a couple weeks, hopefully. And with that, I will step aside.